Gotta wait for the posse.
How you doing?
Good, good, good. Hey,
Yeah, no.
familiar faces. Afternoon, especially with the Hollywood sunglasses you got on over there. All right. Yep. I'm all right. I don't bite. I know today. Good afternoon, all. Thank you for being here. Today, on behalf of the Milwaukee Police Department, I'm pleased to announce the Milwaukee Police Department is now in partner with the Hope Kit Initiative. Hope Kits contain Narcan and are available to anyone in the community. No questions asked. This is to have the 4 actions of preventing overdose deaths. Hope Kits reduce opioid-related overdoses and provide harm reduction to those in our community struggling with opioid use and addiction. Unfortunately, over the past few years, MPD has seen an increase in overdose-related calls. From 2020 to 2022, MPD has administered Narcan 259 times. Again, from 2020 to 2022, MPD has administered Narcan 259 times. MPD's Advanced Crisis Intervention Team will distribute these Hope Kits eventually citywide. But for now, we're starting edition number 2 and 3, where we have seen a higher amount of overdose, unfortunately, in these respective districts. The team will provide education on the use of Narcan kits and also provide resources for those who may wish to seek treatment or counseling services for addiction. It is important to note, Hope Kit Initiative was created by the Community Medical Services with a goal to save lives. Thus, we are grateful for Alderman Michael Murphy, who chairs the Milwaukee City County Heroin, Opioid, and Cocaine Task Force, the Milwaukee Overdose Response Initiative, which is established a community-wide collaboration between the Milwaukee Fire Department, Milwaukee Health Department, and other community stakeholders who began the distribution of Hope Kits back in November 2021. We're also grateful for Sheriff Denita Ball for the Milwaukee County Sheriff's Office for providing the Narcan for our Hope Kits. Together, we are better. Now I'd like to announce Sheriff Ball to come as the next speaker.
Thank you, Chief. The Milwaukee County Sheriff's Office is proud to partner with the Milwaukee Police Department, the Milwaukee Fire Department, and Community Medical Services to provide Narcan for the Hope Kit Initiative. As you know, Narcan is a critical element that's used to revive someone once they are experiencing an overdose. And so as a result, we are happy that we have the ability to partner with them to provide this Narcan because we know that it's going to save lives. We've seen an increase, just like the Milwaukee Police Department, we've seen an increase in our community, whether it's the Milwaukee community, Wisconsin, or throughout the country. It has been alarming, the number of overdose that we have experienced. In 2020 and 2021, we were dispatched to 5 overdoses. And so last year, it was 12. This year, thus far, we have been deployed to 5, and this is just mid-May. And so we know with the summer coming, and there's an increase of the number of people who are on the expressway, and we know that that number is going to increase. But what we're hoping is those who are using drugs do not drive, do not get on the roadway, but they utilize these Hope Kits because this initiative will help save lives. When they choose to drive and be under the influence of narcotics, we know that it impairs the residents, workers, and visitors in Milwaukee County. And so we want to have a safe Milwaukee County, and as a result, we're hoping that they don't do drugs, but as a result, we know that if they utilize these Hope Kits, that they will save lives. So again, on behalf of the Milwaukee County Sheriff's Office, we're pleased to be a partner in this initiative, and we want to do great things in Milwaukee County, so thank you.
Hi, Captain Gregory Miller in the Milwaukee Fire Department. I'm the Mobile Integrated Healthcare Manager and the Director of the Milwaukee Overdose Response Initiative. We're very happy today to be able to be supporting the Milwaukee Police Department, also using the Narcan from the Sheriff's Office to distribute these HOPE kits, which you see on the table here today. And we've talked about these before with the Milwaukee Fire Department. We're distributing these at the scene with an individual who's overdosed. They have that opportunity to take this kit with them and to survive another day. They can also walk up at any time to the Milwaukee Fire Station and receive one. And now they'll have that opportunity from the Milwaukee Police Department. So we're very happy that this is happening, and we have a more wider spread and equitable distribution throughout the community. We also have private and public partners within the Milwaukee Overdose Response Initiative, and one of those is here to speak next, Amanda De Leon from Community Medical Services, and I'll turn it over to her. But again, we're very happy that we're able to support the police in making this harm reduction more available throughout the community. Thank you.
Hey everybody, so it's wonderful to be here at District 2 because it was about a year ago when I was here dropping off Narcan to officers Clifford and Contreras when they asked me, why can't we carry the HOPE kits? My response was, really? You think everyone would give them out like you all do? They said, of course, we should all have access to this across MPD. We see these folks out here every single day and we can't do a thing about it. It would make us all feel better if we can give them this life-saving medication and resources to live another day. That warmed my heart and left me speechless. And for those of you that are close to me, no, I'm not speechless very often. I immediately emailed Chief Lipski and asked him to fit me into his busy schedule for a quick call. Of course, Chief Lipski said, heck yeah, if you can get all the folks to the table, we are all in. So now some staggering numbers. Last year, this county has lost 634 people to an opioid overdose, and 45 deaths are still pending at the medical examiner's office, which will result in 679 deaths this county will see. So far in 2022, we have lost 72 folks to this opioid crisis, and we still have 86 pending cases, which totals out to 153 people. That's about 1.5 people a day that we've lost to this opioid crisis. These are all preventable. Our hopes are to give someone another day to live a life, to live a life free of drugs, to also save a family from having to bury another loved one from a very preventable disease. I would like to thank Officers Clifford and Contreras and also Captain Paget for being amazing leaders in this community and creating a healthier community. To Inspector Seymour Tabasca for talking to the Police Chief Norman and working in the background to make this happen. To the Milwaukee Fire Department, to Maury, which is our Milwaukee Overdose Response Initiative, and to Fire Chief Lipski for always being there for folks when they need it most. We would not be here without you guys. So thank you, every single one of you.
Thank you, Amanda. So as you can see, this collaboration is about our community, it's about safety, it's about health. So we understand that if we don't work together, we're not going to make the impact that our city desires and look for. Any particular questions in regards to this initiative?
Starting today, those kits are available at all MPD stations?
Just district number 2, district number 3. As we continue to get the wheelies out for the first rollout of trying to ensure that we're going to know what this process looks like and what the need is. We know that this is going to be a citywide effort. No community is unscathed from this particular type of issue, and we understand that we need to ensure that we're going to be able to have a good process. So we're starting out where the need is greatest right now.
How many do we have?
I do not know, but I know that we can get back to you with regards to what the availability is. I know that we have a great partnership with not only the Milwaukee County Sheriff Office, but also with the county. So I'm sure that no matter what, we're going to continue to provide what's necessary to ensure the safety of our community.
And this is also to protect your officers too, right? You know, because they're exposed to it often.
Actually, you made a good point. As we all know, that when we see some of the unfortunate layer across I don't want to say contamination, but the use of drugs are mixed. We all know that at any given time, there may be some type of opioid exposure or fentanyl exposure to our officers when they're recovering and testing. So we do have it within our own squads and then within the district, but now we're again partner up with all these community partners to have it where we're not only having it available through our squads, but also at our respective district stations.
And if I come in, there's no questions asked? Like no background questions about asking for food?
This will be counterproductive if we had to go through the level of scrutiny when someone asks them for help in this particular manner. So we made that commitment to be assistive and available, and only through a no questions asked type of interaction will that be able to get the greatest outreach and reception of use of this particular program. All right, sounds good. Thank you.